Nobody actually is totally healthy. Some of our professors back when said, well, if you think a person is totally healthy, you didn't look thoroughly enough. I'm Dr. Friedrichson. I'm MD, PhD. I went to normal high school or elementary high school in Germany, and then got a scholarship to attend a private boys' school in Indianapolis, Indiana. I graduated from high school there, went back to Germany, studied biology and biochemistry at the University of Tübingen, got there my PhD degree as a human geneticist, did my research there, and then in 1976 I was head of a department, got the job as a head of a department for serological genetics in the human genetics department of the University of Heidelberg. And from that time on, I went in addition to medical school and did my MD. So that's why I am a biochemist and a medical doctor. From that time on, since 1976 I started out with research in genetics. In our development from the beginning, when we are unborn yet, we start out as embryos, go to fetal status, and then we are born after 9 months of gestation. And in the beginning, we start out with stem cells, embryonic stem cells. Later on, it's a diversification. So the stem cells diversify. They know they will get heart, they will get liver, will get brain, whatever. And when we are born, we still have quite a few active ones. But the older we get, the more they are shut down. And we now know from research that there are still some hidden stem cells in the liver, in the bone marrow, even in the brain they found it, but they are not able to be reactivated. With a cell therapy, we could show that even body's own stem cells can be regenerated. So our cell therapy helps the body actually reactivate organ-specific stem cells to help repair their own organs. We started out with cell therapy in 1976. In patients, we're doing that since 1982. And since that time, we did thousands and thousands of patients from all over the world. The older we get, the sicker we get, the degenerative diseases come. It depends on environmental causes, toxins, our lifestyle, whatever. And the cell therapy is repairing. It's not what would we say rejuvenation. It repairs what can be repaired. That means if your gene subset allows you to be 100 years old, and we do from the beginning everything against that we don't get that old through our lifestyle. And with the cell therapy, we can partially rebuild, regenerate those defects. And for example, heart diseases or kidney diseases, or especially liver diseases, we can boost the normal activity of healthy cells and get the body to help repair itself. Cell therapy has been proven that it works, and it helps to treat millions of people over the last almost 50, 80 years worldwide, especially Parkinson's, multiple sclerosis, even Alzheimer's, and we treat cancer patients. We have Down syndrome, we have chronic infectious diseases like Crohn's disease, like colitis ulcerosa, and a lot more, which can be treated with cell therapy, successfully treated with cell therapy. Cell therapy can repair mutated DNA defect cells if they are chronic infectious, or if they are cancer cells. In some cases, they even can reverse cells which are just on the brink to being cancer cells. What I want definitely to stress is the possibility. If what we are often asked, can cell therapy, can that harm people? No, because that the time where we are collecting those cells is in the embryonic or early fetal stage, which means that you have organ specificity. That it means the cells know where they should go to, where they belong to, and what they are going to be. Brain cells, heart cells, kidney cells, liver cells, but they don't know to whom they belong yet. So if they belong to sheep or belong to humans, that's why we don't have since 1982, since we treat patients, we have never any rejection about the cell therapy. The cell therapy is therapy which helps activate the natural killer cells and so-called repair genes. It's also organospecific, so we can, with growth factors, activate healthy organ cells and push the body's own immune system to help fight the cancer. Also, they can silence some cancer cells by activity of immune cells by himself. So, for example, from the thymus or from the mesenchyme, which is a very important part of the connective tissue, which filters actually out the bad cells and marks those cells, so that the phagocytes, which are eater cells, which we have masses, they can now recognize those cells and kill it. Crohn's disease is a chronic inflammatory disease, autoimmune disease. That's two things. One is the inflammation. The other thing is that the body works against itself. So your immune system is out of balance. What we are trying to do is cut down on inflammation, not only by cell therapy, but we need also some natural ingredients which we get from herbs, and to cut down on the inflammation. The other thing is we modulate the immune system, because we have in an overwhelming reacting immune system, we have not enough so-called suppressor cells. We have to push the suppressor cells a little bit up, that the autoimmune function and the fighting of the immune system against the own body will be calmed down and balanced. And so on these two sides, we can help the body help itself by cutting down on the inflammation, and modulating means regulating the immune system. Multiple sclerosis is also inflammatory, an inflammation problem, autoimmune part in it, and it specializes on neuronal cells, on nerve cells in the brain and in the spine. And to get there, it's pretty hard. First of all, we don't know all the causes which causes the multiple sclerosis. That's why it's a big family of multiple sclerosis diseases. In some cases we say MS-like disease. And what we are trying to do is to focus on the reasons for that. We look for that to get off toxins, heavy metals, and whatsoever. The other thing is we try to cut down the inflammation, the internal inflammation. We call it, sometimes it's so-called silent inflammation. We do that, for example, with boswellia extracts, high dosage, with glutathione, with different antioxidants, and then we try to repair with so-called growth factors the damaged cell lines, the damaged cell that the current in the brain is working properly again. And with those growth factors and from the cell therapy, we can go through the blood-brain barrier, which only a few medicines can at all. But we found that This is working very well. The cell therapy is working very well because that goes through, via the lymph system through the blood-brain barrier and can even repair damaged cell lines and nerve cells. The Parkinson's disease is a neurodegenerative disease whose causes we don't know yet. There are some explanations, some theories, but the theory is not found yet. But what we always see is autoimmune part, which the body works against nerve cells, and that's caused through inflammation. We cut down the inflammation by different means, for example, boswellia, then certain enzymes, antioxidants, glutathione, alpha-lipoic acid, but only IV, not intramuscular or not orally, because there it doesn't work. And then we kick in with the immune balancing cell therapy, because it's just to push the immune system up. We would also push the activity, the inflammation activity up in a Parkinson patient. So that's why we have to immune modulate to cut down on the inflammation, that we get T cells, B cells more active, and NK cells, natural killer cells, to cut down on the damaged cells, so they can get rid of the cell scrap. And what we boost with so-called mesenchymal growth factors is the repair genes, because we have a lot of repair genes when we are born, and the older we get, the more they are shut down. That's why the older we get, the sicker we get. For example, in Parkinson's diseases or in multiple sclerosis, which is also a neurodegenerative disease, we find that in nerve cells the repair genes are shut down too fast and too early, and we can push that up again with the cell therapy. That is one of the most known genetical diseases. We have normally the 21st or 22nd chromosome in a triple, as a triple, and that makes the Down syndrome. So, and we have a lot of different kinds of Down syndrome kids or adults, because that's in most cases we find a mosaic. We find healthy cell lines and diseased cell lines, which are actually an inborn error. Genetic inborn error, and we try, we treat with cell therapy, with growth factors, those damaged cell lines to calm them down and to boost the activity of the brains or the organs, especially also the thymus, because a lot of the Down syndrome kids have chronic diseases, chronic infections, and in former times a lot of those guys or those kids died of diseases, of infections. Now we can fight that, but they still have it, and we have to cope with it. So and the development of the brain, of the nervous system, which is the utmost has the utmost importance in Down syndrome, is that we can boost the regeneration and the normal growth of those kids, as it's known in the Norwegian in the 70s, 80s, that in the Norwegian government boosted or gave money for a research program about Down syndrome kids, and we treated them for 3, 4, 5, 6 years, 5 years was the most, and all of them were able to go to elementary school, which was up until that time not known at all that kids could develop that much. And we have also from the facial, from the side, what the kids look like. They changed also their looks, their faces, which is very important for the public. So it's a developmental treatment in a growing defect in a neurological defect organism. Well, our clinic in the southwest part of Germany, we have coming in, coming out every day between 200 and 220 people. And quite a few are being treated or have been treated with cell therapy. So, and they come the furthest away from Japan or from Tasmania, south of Australia. They extra come for treatment. So, and that's why over the last 30 years we have literally treated thousands of them. People should normally eat healthy, fresh fruit, a lot of antioxidants, normally without preservatives, and they should refrain from at that time from too much meat, red meat. They should refrain from too much white sugar and from a lot of alcohol. If they drink alcohol at all, a glass of wine or half a glass of wine a day is okay. Not on the days of the cell therapy, but 24 hours after that, that's okay. But the amount makes the poison.
Right. Okay.
I think the cell therapy is it will be the gold standard in the future. In my opinion, because we are treating not symptoms but causes with the cell therapy, and the treating only symptoms will definitely lead in the wrong way. It makes people only get sicker, because we are not machines where we have spare parts put in, but we have always to see the people as a human being, as a biosystem as a whole. So we have to take the individual, and not we don't treat a Crohn's disease or whatever, but we treat a person with his own biography, with his own background, and we look at it, what we can repair or help repair there. So we are just treating causes and not symptoms.
Awesome. Thank you very much.